Wouldn't it be nice if you can release the tightness or spasticity of your stroke arm? Getting dressed and even putting on a deodorant under your arm will be so much easier. Well, I got you. In this video, I'm going to show you a technique on how to loosen up the tightness and spasticity of your stroke arm. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. So I had a patient, and let's call him Robert, and he had a stroke about 3 years ago, and at that time that I was seeing him, he's 65 years old. He had a very tight arm. It's very hard for us to straighten it out and stretch. And at that time, at that very day that I needed to see him, he also needs to go to see his doctor. So he asked me to help him get dressed. But since his arm is so tight and spastic, it is hard for us to put on his shirt. So since he does not have anybody, I did my best. But I told Robert, let's try to use the technique I learned from a seminar a few months back and see if that will work. So just stick around and follow along with me, especially if you have tightness and spasticity on your arm. Just a quick reminder, these techniques are not applicable if your arm is just flailing around or if it's flaccid. This is only applicable if your joint or your arm is very tight, spastic, and you have difficulty stretching it, all right? So for Robert's case, his arm is spastic and it is positioned like this. So it is difficult for Robert to flex his shoulder or to move his shoulder towards the front. Difficult for the arm to open up from the side. Difficult for him to extend or straighten out his arm. Also, the wrist is also positioned like this, so it's hard for us to extend the wrist and open the hand. So let's start with the shoulder. If you have shoulder spasticity or tightness, it is usually sticking to your trunk like this. So we need to loosen that up. The technique is to go towards where it is very tight. So if it's tight like this, it's difficult to go up like that, right? So I was telling Robert, I told Robert to move his elbow towards the back even more. So like that. So I'm telling him to, I'm giving him resistance, and I told him to really bring his elbow towards the back, giving him the maximum resistance for about 6 counts. After that, I told Robert to relax, and I tried to stretch his arm towards the front, elbow towards the front, right? And I told him again, Robert, try to move your elbow towards the back. I resisted him. Keep moving to the back. And then about 6 seconds after, I stretch his arm up. If it is stuck there, I told him again to bring that elbow towards the back. And then stretch for about 6 counts until it's open up like that. Now, we also need to open up that arm, right? So I told him to squeeze his underarm as hard as he can. I placed a pillow under his arm like that and squeeze, then I stretch like that. Now, since it opened up a little bit, I gave him resistance here. Told him to squeeze again. Gave him the maximum resistance for about 6 counts again, and then I stretch it. Not too much to the side because that's painful. That's very tight from the deltoid muscle. So stretch him towards an angle, so it's towards the front, until we are able to at least open it up a little bit. After that, we needed to tackle his elbow, which is very, very tight. I told him to try to bring that arm even more towards flexion or bending it, and I gave him a lot of resistance here. So I was pulling his arm. I pulled his arm to make that muscle very, very tired. Once a muscle is tired, it's easier for it to relax, to let go. And so the opposite muscle can take over, or this muscle will let go. So the attendance check for this video is letting go. Letting go, okay? So what are you letting go? We're letting go of that tightness, all right? Or letting go of the negativity in our lives. So remember, type down below for the attendance check the phrase letting go, okay? Let's go back to that elbow, Robert's elbow. So since Robert's elbow is so tight, told him to bring that arm even closer to his shoulder, and I gave him resistance for about 6 counts. And then we stretch it out, okay? I stretched it out for about 15 counts, held it for about 15 counts, so it opened up like that now. I told him to again try to flex or try to bring that arm towards flexion again, and I gave him resistance. So the direction of my force is the opposite direction. He is going this way, right? So I'm giving him about 6 counts of maximum resistance, and then I told him relax, and then I was stretching. All right, so after a while we're able to open up that elbow up to here. Now we needed to tackle the wrist, right? Because when you put on your arm in your shirt, it will be tight. It's hard to put that arm through that sleeve if your wrist is bent like this. So I told Robert to even flex the wrist downwards, and I gave him resistance, right? So I gave him resistance there, and then after 6 counts, I told him to relax, and then I opened it like that, okay? Again, I told him, flex your wrist as hard as you can. I gave him resistance, so he is unable to move that wrist. I gave him the maximum resistance until it's about 6 seconds, and then I stretch it for about 15 counts, right? After that, it should be easier for that arm to get through. So after stretching the wrist, we stretch the shoulder again, up, elbow extended, and wrist extended. Now for the fingers, it's easier to get through even if it is fisting, but in order for you to release those fingers and for that hand to open, I told him to try to squeeze as hard as possible for about 6 counts. After 6 counts, I started with the thumb. The thumb is always the key. I told him to bring that thumb closer to the fingers as hard as he can. Try it yourself if you are somebody who's watching this and you did not have a stroke. Try to make a fist as hard as you can for about 6 counts. Then after that, you will feel your muscles getting tired. It's easier for you to relax, and it's easier for you to open up that hand by stretching it. So that is your contract relax. After that, you do the stretch. All right, so are you able to move your shoulder, your elbow, your wrist, and even your fingers better after doing these exercises or techniques? And if you find this video helpful, please click on that subscribe button. I'm asking you to please click on that subscribe button so that this will reach more people, and consider sharing this video to your family and friends who had a stroke, or to your support group. You might be the key to helping them out, do their exercises and their therapy at home. And if you have any questions, suggestions, or comments, just type it down below in the comment section, including the attendance check, which was the word letting go. I'm sorry, I almost forgot. The attendance check is letting go, all right? And so, just a reminder, consistency is the key and never give up. Until next time, paalam! Shoom!